So we're going to talk about imaging in epilepsy and, okay, so there are several types of imaging, and I have no disclosures to make. We have structural imaging and we also have functional imaging. And the meaning of functional imaging is that we use the abnormal function to see the images, so we know where the abnormal function that may relate to epilepsy is located. You are very familiar, I know, with CT imaging, which you and I know we use mainly in emergency situation, and mainly to look for blood substances. In an epilepsy person who has fallen, perhaps hit her or his head, we want to know if there is any fracture or any bleeding. And CT would be, of course, readily available and overall quite sufficient. The other use, of course, of CT is in picking up calcifications. But now with the MRI, yes, you can surmise where the calcification is too, unless it's and usually for calcified lesions, as you know, it's not really super urgent to have to image for that calcified lesion. So MRI is sort of the mainstay in diagnosing epilepsy and in localizing seizure onset for surgical treatment. So this is, can anybody tell me what this is? This is a cavernoma, cavernous angioma, isn't it? And it's very easy to pick it up on the MRI. So of course, by easy, I mean to say easy in terms of the size and in terms of the experience of the person looking at the MRI image. This is another condition you and I know very well. MRI is needed to pick up hippocampal atrophy. And we owe much to the work of Dr. Gregory Casino and Dr. Cliff Jack in bringing this to the science and the practice of MRI in epilepsy in picking up hippocampal atrophy. This is a normal MRI. You don't see any difference between the left and the right hippocampus, but in this view, you could easily see that the right hippocampus is shriveled. You can see that the inferior ventricle of the inferior horn of the lateral ventricle has become more visible than the other side because the parenchyma has shrunken, and so the inferior horn is now more visible. Another situation with the MRI, which is a corollary to the hippocampal atrophy, is increased signal. You may not see both together. Sometimes you see only